Welcome back. The annual election period for Medicare is happening now through December 7th, and our sponsors at Univera Healthcare are here to answer any questions you may have as you navigate it. Welcome, Andrew Naparella of Univera. Thanks so much for joining me.
Thanks for having me. Great to be here.
Of course. I wanted to start off by telling us what the annual election period is and why it's so important for Medicare coverage.
Now, the Medicare annual election period, it starts October 15th and goes through December 7th. And it's a time of year where Medicare beneficiaries can take a look at their medical and prescription drug coverage for next year, now that the information is available, and decide if they're in the right plan or if they need to make a plan change.
That's right. And Andrew, you were telling me that Western New Yorkers need to be prepared and cognizant about what's happening because there are some changes this year.
Yeah, compared to many recent years, this is a more disruptive year, a year with a lot more changes. That's widespread around the entire country, not just in Western New York. So this is a year where we definitely want to encourage people to really take a look at their coverage. First, start out with what's been sent to them. There's an annual notice of change that's sent to them by their carrier, which will highlight some of the major changes. But then they also want to take a look at making sure that their doctors and the physicians and facilities that they prefer are still going to be working with the plan and what the cost is going to be.
Mm-hmm. How could prescription drugs have been affected, and what should people check for?
Yeah, that's a great question. There have been a lot of changes to prescription drugs, Medicare Part D at the federal level. Mm-hmm. So many health insurance carriers have had to make changes to their formularies or cost shares. So this is really an important thing for people to think about this year, and make sure that they do take the time to make sure that their prescriptions are still going to be covered, to see if the tier has changed, see if their cost share has changed, and if they need to make any changes with their Medicare coverage because of that.
How do you recommend Western New Yorkers prepare navigating through these changes? Because it can be a lot.
It can be a lot. I would recommend that people do that they really research and make sure that their preferred facilities and physicians, their drugs are still going to be covered. They also want to take a look at their supplemental benefits, things like dental, vision, hearing coverage have become so important to people that they're still going to be covered at the appropriate levels. And if they need help, there are plenty of ways that they can do that. They can engage insurance carriers, they can work through a robust network of brokers in Western New York to get some help that they need.
Andrew, do you want to talk about what's new with Univera's Medicare Advantage plans for 2025?
Yeah, very happy to do that. This is a year, again, with a lot of disruption around the industry, lots of changes. So one thing that I think we're very proud of is the fact that we haven't discontinued any of our plans. In Western New York, about 29,000 people are in plans that are being discontinued for 2025. So they have to pick a new plan, or they'll revert back to original Medicare only. And not have Medicare Advantage coverage for January. So those people in particular really need to do some shopping and do their research to make sure that they get enrolled in the right coverage. So thankfully, we haven't disrupted anybody like that. We haven't discontinued any plans, so we're happy about that. We also have a new plan that came out, the Senior Choice Plan. That's a PPO, and it's designed to have extensive medical and hospital coverage to optimize costs throughout the year. And lastly, we actually enhanced our PPO network, which is something that we're very excited for. And that's for the new plan as well as our existing PPO plans. And what that does, it gives people extended out-of-network coverage so that if they travel, we've got a lot of snowbirds in Western New York, people who travel, they will have access to physicians around the country at in-network cost shares.
That's right. And how does the Univera team provide assistance to people as they evaluate their options?
In a number of ways. So I think we have a very robust team, very comprehensive team, and we really try to meet people where they are. So just as an example, when I think about our team, I think about we have a resource center at 205 Park Club Lane in Williamsville, which is our regional headquarters, where people can come in and get help. We also have a team of people that's out in the field going to events that can help people. We have a network of several hundred brokers that we work with that also are educating our products and help people enroll. And if people don't want to leave the house, they can give us a call on the phone or do some research online and then engage us whenever they feel is right.
Nice. And, like we said, this is a time where there's a lot of information coming out, but things change year to year, right? Especially individually.
Absolutely.
And you mentioned it, there are a lot of Western New Yorkers that, take time to leave during the winter. So you want to make sure that the plan that you're choosing is really going to work for your lifestyle, right?
Exactly, yeah. And really, there are so many options available that really the thing for people to think about and the thing that we help with is making sure that they are in the optimal coverage for them and their unique needs. Mm-hmm. Everyone's utilization is a little bit different, as you mentioned. So it's important for people to think about it and go through and verify their drugs and their doctors and what's going to be right for them and their family.
Now, What is the number one question or something that a lot of people are really confused about when it comes to looking into Medicare?
I would say the annual changes every year, it can be a lot, especially in a year like this where there are more changes than in typical years. But generally speaking, it's actually getting into Medicare for the first time. It can be a confusing process and a frustrating process at times for people if they've been on commercial coverage or employer-based coverage for their entire lives. It's very different terminology, different formularies. So that's one thing that our team does, is we can help people understand that process, then help them make the right plan selection. There's been a lot of people that have been in that boat over the last several years. Think about the baby boomers retiring, that big demographic of people moving into retirement age. So it's been a lot for our industry to make sure that those people are prepared and making the right decisions for their coverage as they make that transition.
Well, how can viewers get in touch with you and your team if they would like to work with Univera?
Well, there are a number of ways that they can do that. We do have a website available, myuniveramedicare.com, as well as they can give us a call on the phone. They can stop by a resource center. They can engage us in the community as well at a number of events.
Alrighty, Andrew, thank you so much for coming in and sharing more about this. Viewers, if you would like to learn more about how our sponsors at Univera Healthcare can help you, just visit myuniveramedicare.com. Thanks again for coming in, Andrew.
Thank you very much.